is no magical gout diet. It's best to eat a well-balanced diet with particular focus on not eating high purine foods such as red meat, shellfish, avoiding or temporizing alcohol, particularly beer, grain alcohol. Wine seems to be okay, and avoiding sugary, high fructose corn syrup sweetened foods and drinks. Compared to meat and shellfish and beer, the purine content of most vegetables is trivial, so I wouldn't advise anybody to limit vegetable intake. Vegetables are good for fiber, they're low in fat, they have far more going for them than the small amount of purines that are contained in them. No, that's a bit of kind of an urban legend. Cherry juice really plays no role in treating a gout flare. Now, cherry juice and lots of other fruit juices contain vitamin C, ascorbic acid, and ascorbic acid does play a role in lowering uric acid. So, we often recommend to people just taking vitamin C, 500 to 1,000 milligrams a day. If they're not drinking cherry juice regularly, there's probably no need to add it to the diet. And a lot of fruit juices are high fructose corn syrup. They're flavored extra with it, and that's problematic in people with gout. Slightly. Drinking about 4 cups or so coffee a day, that can lower uric acid level a little bit, but it's certainly not an approach. All of these dietary things we're talking about have a very, very limited ability to lower uric acid, maybe a half to 1 milligram per deciliter, and really most people need a whole lot more uric acid reduction than just 1 milligram. Absolutely. In moderation they can. If people are not well controlled, if their gout is flaring a lot, we really urge them not to drink beer and to really stay away from the grain alcohols, and certainly not to binge drink, but moderation is fine. Portion control is really important these days, whether you're treating gout or cardiovascular disease or diabetes or kidney disease. So the very best foods that people can eat are those that work toward keeping those diseases in check. Now, there is some interesting data on low-fat dairy foods. So I think if people wanted to think about what is kind of helpful in terms of any 1 or 2 particular foods regarding gout, low-fat dairy products are good, and moderation in terms of coffee is good as well. Different patients find different foods and drinks trigger their gout. It's really important for them to just kind of think about, what does it for me? We can make generalizations like red meat, shellfish, beer, because they tend to be the common triggers. But patients should reflect and think, what did it for me?